Let's talk about yesterday's Name That Drug class. I gave you guys a few clues. I said that the suffix of this drug class was pril. It blocks the conversion of angiotensin 1 to angiotensin 2, and that it has been associated with the reaction angioedema. A few people answered ACE inhibitors. They were 100% correct, so let's go a little bit more into it. They do actually all end in pril, and that's a trusted one. I always try and teach my students to learn their suffixes of different medications. It just makes your life so much easier. But then some of these medications don't follow the rules, right? You have like calcium channel blockers that typically end in DIPINE, but then verapamil and diltiazem are just out here making rules of their own. And it does block the conversion of angiotensin 1 to angiotensin 2. And by doing this, it reduces vasoconstriction, which typically reduces the blood pressure. And in the EMS setting, if we are giving an ACE inhibitor, it's most likely going to be for CHF exacerbation. And which ACE inhibitor do we run into most out in the EMS field? Hands down, Lisinopril. Everyone and their mother is prescribed Lisinopril, it seems. And if you do carry an ACE inhibitor on your ambulance, which is unlikely because not a lot of services and departments carry them, it most likely will be enalapril. But if you carry a different one, I am so curious. Let me know what it is. You see so many patients that are prescribed ACE inhibitors out in the field. It is very, very common. It's given for hypertension, but unfortunately it is linked to angioedema. And these patients could have been on this medication for years and bam, out of nowhere, angioedema. And this reaction is more common in women and people of African descent. And then the really bad news for an EMS provider is that if you have a patient with ACE inhibitor-induced angioedema, this is not allergic angioedema, so your typical treatments of epi, Benadryl, a corticosteroid usually are not effective in this case. At the hospital, they typically give them frozen plasma, TXA in some cases, and there are a couple of other treatments. Now, if your protocol says that you can give TXA in this situation, by all means, but where I live, they don't give it for that. But yeah, kind of scary.